Hello, everyone. Hi, Heather. My name is
Hello.
Melissa, and I'm a registered physiotherapist and director of long COVID rehabilitation at Cornerstone Physiotherapy. I'm here today with Heather Tomar, registered dietitian at Cornerstone Physiotherapy, and we're here to have a conversation about her approach to particularly long COVID rehabilitation from a diet perspective. Heather, thank you so much for being here today.
This is great, Melissa. Thank you for having me.
I'd like to start by just asking you about your role at Cornerstone. Can you tell us a little bit about what you do for us?
For sure. So I really help our patients try to optimize their overall health through making dietary changes based on their ability, really. Given that people with long COVID are sometimes feeling unwell to cook and that kind of thing, we can make changes as small as adding in one serving of vegetables per day, or as big as kind of addressing a Mediterranean diet. So I really just try to help folks optimize their overall health by making sure that they're meeting their nutritional needs, which
Mhm.
in long COVID can be very hard to do.
Absolutely. And you touched on something really important there with regards to feeling well enough to cook,
Yeah,
right? In this
absolutely.
population, particularly, we see a lot of fatigue, a lot of intolerance to activity, and it really reduces people's ability to participate in some of these, activities of daily living, and requires them to really rely on other people, and
Hmm.
depend on other people for support here. So it's great to hear that there's strategies. Maybe we can touch on those a little bit later on
For
how
sure.
to kind of approach this when you have really limited energy or limited capacity to cook for yourself or prepare healthy and nutritious meals.
Absolutely.
Um, what is your educational experience as a registered dietitian? And then, if you don't mind, going a bit into your professional experience so people can get to know you a little bit
Sure,
better.
sure. Yeah. So believe it or not, I've been a dietitian for 30 years.
Wow.
Yeah, I know. As I was kept tallying it up, I'm like, wow, that's a really
Yeah.
long time.
Time
So
flies.
it does. I am a regulated health professional with the College of Dietitians of Ontario. I did my training in the United States. I'm from America originally, and I went to Michigan State University and sat for my board there. And then when I came to Canada, I sat for my board here.
Mhm.
In terms of my professional experience, I've mostly done outpatient work.
Okay.
I've worked for hospital outpatient when I was back in Michigan, and most of my career here in Canada in Ontario has been with our family health teams.
Okay.
So I've been part of a multidisciplinary team in every place that I've worked thus far. And I really
Perfect.
love that. It really provides a nice wraparound approach for the clients because I don't feel like any of us have the answer. I
The
think
answer.
there is an answer, and we can all be part of helping patients find that answer.
That's so well put. Do you have any particular populations or conditions that you've worked with specifically, or is it more around
Yeah.
kind of general health and, as you mentioned earlier, trying to optimize health
Yeah,
for the
so
individual?
in family practice, we cradle to grave.
Mm-hmm. Mm-hmm.
I would see young children, I would see
Mm-hmm.
elderly folks, and a lot of chronic conditions, diabetes,
Mm-hmm.
cardiovascular disease, cancer on
Mm-hmm.
occasion, a lot of GI issues,
Mm-hmm.
whether they be diagnosed or kind of more general IBS.
Mm-hmm.
Weight loss was something that was always a part of the picture
Mm-hmm.
in addressing some of those chronic diseases, although I don't think
Right.
it's the end all be all. I
For
think
everyone. Mm-hmm.
quality of diet
Mm-hmm.
trumps losing weight in
Trump's calorie
whatever.
deficit.
Correct.
Mm-hmm.
Absolutely.
Mm-hmm.
Absolutely.
Okay.
So, really looking at quality and
Mm-hmm.
trying to help people approach their health conditions, chronic health conditions, with diet as an adjunct, perhaps to medication. But it
Mm-hmm.
all has to work together.
Absolutely, absolutely. So switching gears a bit to long COVID specifically, which is kind of the impetus for you coming to Cornerstone, was
Yeah.
we have this program, and we were finding that diet seemed to be this there was a growing understanding that diet is a big part, or can be a big part of both triggering of symptoms of long COVID and persistent symptoms of long COVID, but also a part of the recovery or the healing process from the condition. So you've had some opportunity now to work with some of our patients for a while. Could you outline as best you could some of the major dietary or symptom patterns you're seeing in individuals living with long COVID?
Yeah, for sure. And I did make a little list here because they're so varied. I wanted to try not to miss anything. So if my eyes go down, I'm just looking at my list. So obviously a big one is loss of smell, loss of taste, lack of appetite because of that. They don't smell good, they don't taste good. There's been a lot of patients who have nausea, vomiting upon eating or even smelling food. Folks with lots of GI upset, that can be new or exacerbated is what I'm finding. They may have had a pre-existing condition where they couldn't tolerate certain foods, but now it's become quite exacerbated and more prominent, maybe leading to diarrhea, constipation, gas, bloating, stomach distension. A lot of signs of like what I would have in primary care would have called IBS. So that, and then looking at hydration or dehydration, I'm noticing folks are having a challenge getting in vegetables, getting in fruits. There can be a lot of preparation to vegetables, the way we think about eating vegetables traditionally, and preparing, chopping and cutting and cleaning and peeling and all of that. And then there's a lack of fiber there as well, because a lot of times the food that sounds good to folks who are struggling, it depends on where they are in their recovery, but it's very simple. It's simple carbohydrates, crackers, cereal, bread, things that are naturally soothing when we think about not feeling well. And so the diet becomes a little bit overrun with those simple, more convenient foods that aren't very rounded out, I guess.
Nutritiously dense.
Yeah, that's a good way to put it. Yeah. And then I do, I'm kind of big on protein, making sure people are getting sources of protein in, whether that come from nuts, seeds, beans, like a vegetarian source, or if it comes from animal sources, or a combination thereof. So when I know we'll talk a little bit later about the Mediterranean diet and how that can be helpful as a way to introduce more of those foods back into the diet.
Perfect. Well, why don't we talk about the Mediterranean diet now, if you don't mind?
Absolutely.
What is kind of the, I guess, purpose of engaging in a Mediterranean diet, and specifically to long COVID, and then just kind of on a more general sense as well?
Sure. Yeah. So what we do know is that there is this systemic inflammatory activity going on for people with long COVID. And so if we can help to minimize the amount of inflammation that's in the system by modifying the diet, i.e. removing inflammatory foods and promoting inflammatory or anti-inflammatory foods, then we can try to level the playing field a little bit. So the Mediterranean diet is a strong emphasis on healthy fats coming from extra virgin olive oil, up to 4 tablespoons a day, which kind of freaks people out because we've been such a fat phobic society for so long. But now we know that these healthy fats can actually be really good for this systemic inflammation that people are dealing with. That can also come from nuts, seeds, and beans, avocado, or nuts and seeds and avocado. The diet promotes. So I like the diet because it's not so much about taking things away.
Restrictive.
It's about additive. Could we eat more fruits? Could we eat more vegetables? Could we eat more nuts, beans, seeds, more seafood versus our processed meats, red meats, high fat meats, because those tend to be inflammatory. More seafood if you can. And then getting away from very simple carbohydrates and trying to introduce more complex carbohydrates that are going to provide lots more nutrition, polyphenols, antioxidants, all of the good stuff that our body needs to fight and to heal
Mm-hmm.
in order
Mm-hmm.
for people to start feeling better. And again, as I mentioned previously, this all tends to slip. Even, I have so many patients who have told me, I used to eat such a healthy diet. I used to be such a good eater. I
Mm-hmm.
really worked on this a lot, but because of their limited capacity,
Mm-hmm.
those things have slipped away. Or like you said, Melissa, they've come to rely on other people for the
Mm-hmm.
food prep, and it may not be exactly what they're used to
They're used to or wanting,
or
right?
wanting.
Mm-hmm.
Exactly.
Absolutely.
So
Okay.
again, I try to meet with people where they
Well,
are
there are.
and, figure out, okay, where are the gaps? How can we fill those gaps? And it doesn't have to be a complete overhaul. It can be a stepwise process. And then people can start to feel a little bit better and then maybe a little more better. And then we take on as much as we can. And then
Mm-hmm.
we pause and
Mm-hmm.
we hold for a little bit, right? So it
Yeah.
doesn't have to be this quick progressive thing, because a lot of people aren't capable of that. I've had patients
Absolutely.
tell me this week, thank you so much for taking it slow with me, right?
Yeah.
And
Yeah.
so I thought about what you do as a physiotherapist and how that
Mm-hmm.
pacing of physical
Mm-hmm.
activity is so important. Well, I feel like the pacing of improvement in the diet is important
Mm-hmm.
as well.
Absolutely. And we just know that as human beings, it's not easy necessarily to change habits in the best of circumstances, right? It takes
Exactly.
energy, it takes planning, it takes cognitive resources that our patients a lot of them are experiencing some degree of, cognitive impairment, brain fog, secondary to the condition, um, makes it even that much more challenging to engage in making large changes. And I think you touched on something really important too, that when you make a change, it's good to spend some time in that change to really evaluate the benefit that you're getting from that change, right? It's not like all of a sudden I had a really good day of eating a lot of vegetables and the next day I'm feeling 50% better than I did before, right? Like there's accumulation that has to happen, right?
That's right. That's right.
Physiologically. And we see this with things like exercise and activity modification and things like that. It's not just, oh, one day I paced my activity and I
Mm-hmm.
started to feel better. It often takes days for the system to settle down, especially
Yeah.
after post-exertional malaise and things like that. So
Yeah. And
I think,
with diet, it can take months.
right,
Really,
right.
right? So
Mm-hmm,
you may notice so I try to have my clients notice small changes and
mm-hmm,
small improvements that
yeah,
hopefully those small ones will all add up to larger changes and more sustained energy and feeling better and being able
absolutely.
to make it through the day just a little bit longer.
Mm-hmm,
And
mm-hmm.
it really does all add up.
Right,
The
absolutely.
body knows how to heal.
Mm-hmm.
And if we
We just
can
need to
give
give
it
it the tools.
we need to
Mm-hmm,
help it along, give it the tools, make sure that all the goodness is there. So even if it's just a small amount of goodness,
mm-hmm, mm-hmm.
the body knows what to do with
What to
it,
do.
right?
Exactly.
And
Yeah,
that's where like supplements would come in too. Is there a
perfect.
room for supplementation,
Mm-hmm.
where maybe the diet is not as strong? For
Lacking. Mm-hmm,
instance, like omega-3 fatty acids. If you're not a
mm-hmm,
fan of fish and you aren't up to adding flax seeds and hemp seeds and chia seeds to your food right now, maybe an
mm-hmm,
omega-3 fatty acid is what your body needs for now and what you
mm-hmm,
need right now to
mm-hmm.
meet those needs. And then later on down the road, then we can start incorporating some of those other foods, right? So
Yeah, getting it from
supplements,
a natural source. Yeah.
yeah,
Mm-hmm,
so
mm-hmm,
supplements have a role in this as well.
mm-hmm,
And I know we'll talk about that a little bit towards the end of the interview,
mm-hmm,
but
mm-hmm.
that is part of the picture as well.
Absolutely. And I know as physiotherapists, we get a lot of questions around supplements, especially in this condition that, there doesn't seem to be one answer, as you mentioned earlier, right? It seems as though the people that are improving or getting better are finding the strategies that work for themselves and getting back to those fundamentals, that foundation of health, right? Diet, sleep, exercise, mental health, right?
Yeah. If the
Um,
foundation isn't there, it makes it even harder for those supplements to do their job,
Absolutely.
right?
Absolutely. Okay, so we've talked about the Mediterranean diet now, and that seems to be something that everyone who's experiencing long COVID would benefit from to some degree, depending on, like you said, where they're at in terms of the food choices they're already making. Could we talk a little bit about that IBS type presentation that you mentioned? My understanding of that condition is it's very broad and it's difficult to identify and diagnose sometimes, and there isn't necessarily always a straightforward solution to people who are having these ongoing GI symptoms. Do you have an approach that you like to use with people, or like a dietary approach that you like to use with people, generally with IBS, or is it very much individual?
Well, it can be individualized. First, I like to identify if they are endorsing the symptoms of IBS, which is gas, bloating, distension, alternating constipation, diarrhea. Sometimes there's some brain fog that goes along with that. So if they're endorsing 4 or 5 of those symptoms, I usually have them do a questionnaire for IBS, and I get a rating on a scale of 1 to 10 to find out kind of where their issues are. In the diet that I like to use, if the client is game, and there are lots of variations. So it's called the low FODMAPs diet, and FODMAPs is an acronym that stands for a variety of short chain carbohydrates that are in high amounts in certain foods. So what happens with folks who have IBS, they do not have the capacity to break down those short chain sugars. They make it all the way down to the colon, and then the little microbes down in the colon have a heyday with all this unbroken down food that makes it there, and then that causes the gas, the bloating, the burping, the distension, the constipation, diarrhea are alternating. So the theory is if you can remove all of those short chain sugars from the diet for a period of time, not forever.
Right. Yeah, that's important.
And symptoms disappear. So it is a very much symptom-based approach. So the elimination, symptoms disappear in an ideal world, then we would challenge the foods that have been taken away by category.
Sort of individually, right?
Individually, right. Yeah. And the challenge is usually about a week at a time for each new category or each letter of that acronym, FODMAP, that we would challenge. But a lot of the common foods that have to be removed in the beginning would be wheat, rye, and barley. And it's not because of the gluten, it's because of the short chain sugar.
Short chain sugar. Okay.
That's there. Onion and garlic are super big triggers for some people. Broccoli, cauliflower can be really big triggers for some people. Apples, bananas can be triggers for people. Honey can be a trigger for people. So it's foods that are for the general population that are very healthy. But it's just that these particular people, myself included, can't break down certain ones. So for me, mine are all wheat, rye, and barley, onion, garlic, and I can do avocado sometimes, but not too much. Avocado is another high FODMAP. So it's hard because you do take away a lot of what is perceived as healthy foods, but then we can challenge these back. And then when we challenge them back,
maybe identify which ones are the big culprits. Maybe.
Exactly. And then you can find your triggers, and then moving forward, then you learn to try to stay away from those triggers as much as possible. And once you decrease the threshold so low, there's sometimes some wiggle room to be able to have a little bit of garlic or a little bit of
avocado.
Yeah, a little bit of avocado. Yeah, exactly.
Right. Okay.
So it's not an end all be all elimination forever, but that's why it's very important to work through it with someone who is educated in it, because a lot of times people will remove everything, they'll feel better, and then they'll start eating everything again, and they don't
really know. Exactly.
Right.
Then the symptoms return and they're kind of back to
or it takes so long for them to get back up to the same threshold that they were before. They can eat these things and think, oh, well, I'm fine now. And then all of a sudden the threshold gets up there and they're like, oh, I'm not fine.
I'm not doing well with these anymore. Yeah.
Yeah. So, I do like to check that. And it's usually about a 2 to 3 month process for
Okay.
people to go through it. So it's not forever.
Not forever.
And then I always have people challenge their most missed foods first,
Right. So it's not
right?
necessarily the ones that might be more obvious, right? It's like, what are
Right.
you missing? What are you
What are you
struggling not
missing?
having?
That's right. Let's
Let's
have
try
that
that first.
first. Yeah.
Hmm.
And
Hmm.
then there's a yay or a nay, or there's a yay and at a
With
small
an
amount.
asterisk,
Sure. Yeah.
right?
Yeah,
Hmm.
exactly. Exactly.
Okay. Okay. That's really, I didn't know a lot of that information. So that's really great to know. I
Well,
know
it
some
is
of,
it is it's one of the tools that thank goodness we've figured out, right?
hmm
Science has
hmm
figured out,
hmm
because before IBS was sort of just a sorry, you just need to
hmm
deal with it, right? This is going to be
right.
your life, and you'd
There
have to
wasn't even
manage
like the
manage
idea of
symptoms. No.
reducing your or changing your diet. It was just, oh,
Mm-mm, mm-mm.
too bad for you. That's
Yeah,
really unfortunate.
exactly. So
Yeah.
again, what I'm finding in working with our long COVID patients is that they may have had a little bit of dietary upset with certain
hmm
foods, and sometimes now it's
hmm
exacerbated. It's
hmm
gotten
hmm
worse since they got
hmm
long COVID because of this overall and systemic
Systemic
inflammation.
inflammation.
Mhm.
Absolutely. Yeah, that makes a lot of sense. There's been a
Mhm.
few other, I've tried to stay somewhat on top of the research in the different areas. Obviously, diet not being my scope of practice. But there's definitely talk and chatter around low histamine diets, gluten-free diets. Can you speak to those, and have you used those approaches with any patients? And if so, when kind of
Yeah,
thing would you choose
absolutely.
that?
There's there's a lot of wisdom in our patients,
Mm,
right? They know themselves, and they're kind of like, I've wondered if I should go gluten free. My
mhm,
sister has gluten sensitivity.
mhm.
Um, I think maybe I should try that. So sometimes it's more I just go with the patient's intuition on
Right.
that. But again, if they have the abdo pain, they have IBS like symptoms, nausea, vomiting, and even brain fog goes
Mm-hmm.
along with a diet that has gluten in it.
Mm,
Sometimes people's brain fog clears. And we also know that this is a symptom of long COVID as
right.
well. So if
Absolutely.
we can minimize the amount of brain fog, if it is being exacerbated by the diet, we remove the gluten. And now
Mm-hmm.
here we're removing the protein.
Mm-hmm. It's not
Okay,
the short chain
it's
sugar
not the short chain
this
sugar,
time.
it's the protein.
Mm-hmm.
So we're removing that. And usually within, 2 weeks,
Mm-hmm.
people will know if they feel better. So,
Mm-hmm.
as an example, I had a client who reduced the gluten in her diet, and she's like, literally was pulling herself up the stairs by the railing. And she's
Mm-hmm.
like, I can walk up the stairs now. I'm not, my body isn't aching.
Mm, wow.
Right. So it
Incredible.
can be inflammatory for some people, and it affects
Mm-hmm.
the lining of the gut, and then it
Mm-hmm.
allows some things that shouldn't be leaking through to leak it out. That's kind of
Into
the
where that's
theory,
not
into
meant
the
to
where
be.
it's not meant to be. Yeah, without
Right.
getting to, without going to all
Yeah.
the levels of the intestine and all of that
Mm-hmm.
kind of stuff.
Okay.
But so that can be helpful. So if somebody doesn't want to do a full low FODMAPs,
Mm-hmm.
sometimes just
Just
removing
even starting
gluten,
there. Mm-hmm.
by removing those short chain sugars and those proteins, by
Mm-hmm.
taking wheat, rye, and barley out of the equation, that
Mm-hmm.
can, in and of itself, give people some relief.
Wonderful. Okay.
So again, sort of looping back, how can we help our clients optimize their sense of well-being?
Mm-hmm.
And
Mm-hmm.
diet can be a piece of that. So if they can even
Yeah.
feel 10 or 15% better because of dietary changes, that
Mm-hmm.
may be the next step towards the light at the end of the tunnel.
Absolutely. And it all feeds into, your psychological well-being, your physical well-being. Like you mentioned, the pulling up the stairs, right? In physio, as a long COVID physio, I would be thinking, oh, that's related to orthostatic intolerance or POTS or potentially chronic fatigue syndrome type presentation. But really, there was another underlying issue that was
Yep.
related to what she was eating.
Right.
And, maybe it didn't give all of her energy back, but it gave her enough energy back that she could start to participate in her life and have a higher quality of life. So
Yeah,
that's
her exercise bouts were much more productive.
amazing.
She didn't feel unwell after them.
Hmm.
So, she made other changes too.
Of course.
So,
Yeah. Again, not a
yeah,
one size fits all, and it's
no,
never just a single solution, but part of
exactly,
the puzzle. And then
exactly.
have you used a low histamine diet, or sort of made
Yeah,
some low histamine type
recommendations.
recommendations?
Yes,
Yeah.
yeah. So it's easier to talk about a high histamine diet to give
Okay.
folks a sense of what is that.
Hmm.
So sometimes what we're seeing is this mast cell activation syndrome that
Hmm.
may be going on, very hard to diagnose.
Yes.
So again, an elimination approach can be a way to kind of test the waters there to see if
Hmm.
that may be something that's going on for someone. So they're having less tolerance of things that cause a histamine reaction. And
Okay.
those in my world are things like, I'm looking at my list here: vinegar,
Hmm.
food that's been sitting around for a while, canned
Hmm.
meats, especially canned fish, aged meats, fermented foods, mature cheeses, yeast, sourdough, sauerkraut, eggplant, avocado, legumes, pickled veggies, citrus, dark chocolate, alcohol, walnuts, cashews, and peanuts. Like, again,
Okay. Yeah.
all very healthy foods,
Hmm. Maybe
but
minus the alcohol, but
minus the, yeah, thank you for editing that.
yeah.
Um, but all, seemingly healthy foods that can impact somebody. And again, there's it seems to be like a threshold situation going on there
Right.
too. You might be able
Hmm.
to have a little vinegar but not a lot, or you might be able to have some fermented food. Yogurt doesn't work, but kefir does,
Okay. Yeah. So
right?
it's
Like,
a lot of
there's
experimentation
a
there, right?
lot of
Yeah.
experimentation. Yeah.
Yeah.
And typically someone has to be kind of progressed pretty, to pretty well through, and they're at a point where they're like,
Hmm.
okay, let's
Hmm.
start fine tuning this. But
Right.
it,
Right.
but it,
I've got
it
the
could,
foundations or the
yeah,
fundamentals here kind of thing,
yeah.
but
And
could
things
there
haven't
be
cleared up.
other things?
Yeah.
And things have not, maybe improved to the
Yeah.
degree that we would like them to. Hmm.
That's right. That's right.
Okay.
So, so that one's a good one to walk through an experienced person with as
Hmm.
well.
Amazing.
Again, this is not an end all be all. It's not forever, but if we could get a little bit of improvement by taking out a certain group or limiting foods from this group of
Hmm.
foods, and you feel a bit better, would it be worth it? And I always weigh
Hmm.
that with the clients as well,
Hmm.
right? Like, is this worth it to you? Now,
Right.
for me, is it
Right.
worth giving up dark chocolate?
Maybe
I
not.
don't, maybe not, right?
Maybe not.
So
Yeah. Hmm.
everybody has a choice
Hmm.
in what the changes that they want to make or try. And
Hmm.
again, it's just your diet, right?
Right.
It's even
Hmm.
easier than paint colors, right? You can
Right.
make a mistake and you can go back.
And you can recover from it. Exactly.
Yeah,
Hmm.
exactly.
Hmm.
Right. And
Hmm.
I'm
It's
only
not
recommending
permanent.
things that could make people better and not worse.
Right. Right. Exactly. Okay. Fantastic. There's kind of one more area I wanted to talk about, or one more, I guess, kind of strategy or approach that we've seen on the physio side to be pretty useful. From a dietary perspective, before we brought you onto our team and all of your expertise, is the role of controlling blood sugar in
Mhm.
long COVID. We came kind of about this idea due to previous research around chronic fatigue syndrome, a metabolic disorder that affects the mitochondria of our cells, the little powerhouses of our cells, where we generate 90% of the energy of our body. And, some of those energy pathways require glucose, right?
Right.
Glucose coming from our food. And a lot of our patients, or not all of our patients, but a lot of our patients found it useful to start cutting out, sugar, eating a little bit more as like a more typical type 2 diabetes diet.
Mhm.
Have you found this in your practice as well? Or what do you feel the role of controlling blood sugar is? in long
Yeah.
COVID
Yeah.
recovery?
So, I look at it kind of big picture, that, I mean, even in the general population, not everybody has good control of their blood sugars,
Right.
right? Just by nature of the standard Canadian diet.
Hmm.
But I think the more you can control your blood sugars, it's going to provide a more soothing role of your energy versus having high blood sugars that tend to drop, right?
Got it.
And this feels bad.
I
This
was
can
gonna
feel
say.
good. This can feel
Yeah.
good depending,
You
what
got
you're eating. If it's a donut,
energy.
right? Yeah,
Yeah.
you've got some quick energy, but then you're gonna crash. So what I like to help people do in terms of managing their blood sugars is is really making sure that they're eating more complex carbohydrates. They're eating smaller amounts of them spread throughout the day. They're eating a good amount of fiber in their diet, and they're strategically eating protein, whether it be animal-based protein or vegetarian protein throughout the day, to see if their level of energy kind of smooths out.
Stabilizes or
It
smooths out.
stabilizes. Yeah, yeah, if it
Okay.
stabilizes. And there's a lot of people who stay away from protein for one reason or another.
Hmm.
Because well, I can't eat meat because it's got fat or
Hmm.
whatever, or
Hmm.
nuts are fattening, I can't have nuts. But trying to get people to eat more plant-based protein, adding that to their diet, getting protein spread throughout the day. So it
Hmm.
levels out their blood sugars. So if they do have a long COVID crash
Hmm. Hmm.
from too long of
Physical exertion
a
or
physical exertion, too long of a phone
cognitive
call, the
exertion.
visit was too long with
Mhm.
auntie,
Mhm.
um, they can rule out that, okay, yeah, this was a long COVID crash versus this was a dietary crash,
It's a blood sugar crash.
like a
Okay,
blood sugar crash, right?
that's a
So
really
for,
good way to think about it.
yeah, so really trying to minimize the number of crashes you'd have from a dietary perspective. So we try to
Hmm.
bring the sweets down, or if you are going to have a sweet, pair it with a protein
Right.
so
Hmm.
that you
Hmm.
don't go so high and you do
Right.
have this protein that sort of just
More
rolls you
curve.
along. Yeah,
Hmm.
exactly.
Versus the
That
big
makes sense.
spike. That
Yes,
makes a lot of
exactly.
sense.
Hmm.
Absolutely. Okay,
So
thank you.
protein, yeah, protein, fiber, complex carbohydrates spread throughout the day. And then, kind of just looking at making sure no one meal has overabundant amount of carbohydrate.
Right. In isolation. That makes
Yeah.
a lot of sense. Okay. Okay, if it's okay, I'd like to circle back to something we touched on earlier around supplementation. As I said, as physios, we actually get a lot of questions about this. Even outside of the long COVID population, how can I optimize my health with supplements? And I know that you've done some digging in the literature, the long COVID literature, about supplementation in long COVID. So, are there specific supplements that you are finding yourself recommending kind of across the board a lot of the time? And if so, are they backed by some research?
Mm-hmm. So, yeah, there are some that I am definitely recommending and making sure people are getting enough vitamin D.
Mm-hmm.
Uh, because of where we live and our lack of sun exposure, especially this time of year,
Right.
people can tend to run a little deficient of vitamin D. So a lot of people have really good stores and we make it through the winter just fine. But if you were
Mm-hmm.
already on the lower end of normal, and then winter comes, you're also experiencing long COVID where you're not out walking like you used to even in the winter sunshine,
Mm-hmm.
and you're more housebound, our skin doesn't get an opportunity to make that vitamin D. So
Mm-hmm.
supplementation is really, really important.
Mm-hmm.
1,000 international units is kind of a typical starting place, but I also like to know if people have had deficiencies in the past, if they have family history of deficiencies. It does seem to run in families.
Mm-hmm.
And then because my recommendations are going to be very different than a
Mm-hmm.
thousand IU if I know
Dependent
that
on the
there is a
person.
deficiency. Yeah,
Mm-hmm. Mm-hmm.
exactly. exactly.
Okay.
And so that's one. Omega-3 fatty acids,
Okay.
again, as
Yeah.
my example
Again.
earlier.
Mm-hmm.
If you're not eating like a fatty fish, like a trout or salmon or mackerel, sardines on a regular basis, then maybe you do want to supplement with some
Okay.
omega-3 fatty acid. And if you're a vegetarian, we can go with flaxseed oil.
Mm.
We can supplement with that instead. So I can, personalize it to a person's eating preferences. A B complex really supports the nervous system.
Mm-hmm.
There is some evidence that says B1, B2, and B3 in larger doses can be
Mm-hmm.
helpful for long COVID. I really like a complex because they work synergistically, the B
Mm-hmm.
vitamins together, right? So a lot of
Mm-hmm.
times people will take B12 in isolation because they're a
Mm-hmm.
vegetarian, let's say, or they've been
Mm-hmm.
told their B12 levels are low.
Very low.
I really do like to see more of a concert going on there with all of the Bs. And when we're under stress, our body plows through
Mm.
B vitamins,
Okay.
our central nervous system, right? So
Mm-hmm.
B vitamins support the nervous system. And to me,
Interesting.
long COVID is a tax
Yeah.
on the nervous system.
Nervous
So we
system.
want to make sure that we're bolstering that.
Supporting it.
Some supplements that have been researched a lot, CoQ10, enzyme CoQ10
Mm-hmm.
is also there's some evidence that shows points towards helping with long COVID. So
Mm-hmm.
that's one. It's very safe that I can
Mm-hmm.
recommend. By the way, omega-3 fatty acids should not be taken by people who have or on blood thinners or have a blood clotting disorder.
Good to know.
So I look for contraindications as well
Perfect.
before I
For making any recommendations.
before
Mm-hmm.
making any recommendations. And if I'm unsure, I always refer people back to their pharmacist, especially with their pharmacological drugs,
Right.
making sure that there's not going to be any interactions. Curcumin is a known
Mm-hmm.
anti-inflammatory. So whether they're going to eat more turmeric in their diet or
Okay.
they're going to take
Turmeric. Mm-hmm.
curcumin tablets,
Mm-hmm.
then they can do that.
Mm-hmm.
There is another supplement called N-acetylcysteine that's
Mm-hmm.
very high
And
in
AC, I think, is the
it's yeah,
acronym.
NAC.
Mm-hmm.
Uh-huh. And a lot of
Mm-hmm.
people, I probably know it better by NAC.
Right.
And it virtually is a super antioxidant, right? And so
Mm-hmm.
what's going on in the body? Oxidation. What do we want? Antioxidation going on in the body. So I
Mm-hmm.
have guidelines and recommendations around that, around starting doses and
Mm-hmm.
continuation doses, especially if people are very sensitive to
Mm-hmm.
things that they take. I'll start out with a half dose, see how they
Mm-hmm.
tolerate, and then have them build up
Love
to a
that.
full dose. So those are the ones that I feel most comfortable.
Mm-hmm.
And I am informed on all of them because a lot of people
Mm-hmm.
come to me on a much longer list of supplements that
Mm-hmm.
they're taking. And so I just want to
Mm-hmm.
make sure that they're doing it in a safe way.
Absolutely.
Yeah,
Absolutely.
I don't want to take something away that potentially could be working for them.
Mm-hmm.
But I
Mm-hmm.
also need to stay in my scope of practice as well. So I
Makes
just want
sense.
to make sure people are safe.
Absolutely. No, that was a really great, very insightful answer. I learned a lot
Okay.
about supplementation, so thank
Okay.
you.
Good.
We're getting to the end of our list of questions. I did want to kind of shift gears a little bit away from long COVID for a second, as much as it pains me to.
Yeah.
You've started to see some patients in some of our other programs at Cornerstone. So we have other specialty programs, including pelvic health, vestibular, post-concussion as well. Do you change your approaches with people, coming from different conditions, different, excuse me, than long COVID? Um, and if so, maybe like an example of how you might.
Yeah. So, we talked about such a breadth of ways to approach people in terms
Mm-hmm.
of diet that I
Yeah,
really do apply a lot of these strategies with our
across the
non-long
board.
COVID patients. Yeah.
Mm-hmm.
With pelvic health, sometimes I'm being referred folks who have some GI distress, and that's why they're seeing the pelvic health practitioner. And
Mm-hmm.
so, yeah, I may work with them with a low FODMAPs diet, if I think it might be IBS, or say someone has ulcerative colitis, there's definite guidelines there that I would bring in, especially if there's a chronic condition layered in with the work that our physiotherapists are doing.
Okay.
But no, for the most part, I would use kind of the breadth that we talked about. The Mediterranean diet really just does seem to point to a lot of the answers, because a lot of what our other clients are in for is inflammation based.
Right. Thinking about post-concussion syndrome, right, is an inflammatory, sustained inflammatory response in the brain, right? After a head injury. So that just intuitively makes a lot of sense, right? Or a vestibular condition that was brought on by, an acute viral infection, and then there's sustained inflammation that's happening after that, right?
Exactly.
It can be,
it transfers, and it transfers, with any of our pelvic floor ladies, especially menopausal women, I will really help them focus on where they are in their menopause journey and what they need to be watching for. As we age as women and our estrogen levels decline, we can become at higher risk for bone fractures. Our bones aren't as strong. Cardiovascular disease becomes more of an issue for us. And so we want to make sure that folks are taking care of that aspect of their life as well. And that goes for all of our patients, the long COVID patients as well. If I see a postmenopausal woman in the long COVID program, I'm going to make sure she's getting sources of calcium in her diet that are going to support her bone health, because I don't want her general health to decline because we're so focused on long COVID and recovering from that.
It's a part of the picture. It's not necessarily always the whole picture.
And it's treating the whole person, right? Not just their disease. It's treating the whole person, or their disease or their condition. So, so I pull in everything.
Fantastic. That was great. Thank you. Okay, just a few logistical questions to finish up. How long do you typically, or how long are your appointments? So like an initial appointment and follow-up appointments, and how often are you seeing your patients, or does it really depend on the strategies and the person in front of you?
Yeah. So the length of my first initial assessment usually is about little less than an hour. And by that point, I've received an initial assessment form from the client, and I've received a food diary. And in most cases, I've received the Mediterranean eating questionnaire. So I have a lot of information already. So I like to try to hit the ground running so that we
filling
can
in the gaps.
Fill in the gaps and use it for purposeful strategy and problem solving when it comes to changes that they would like to make. So so that visit is typically about an hour long, and then my follow-ups are about 30 minutes. And I'm seeing patients about every 3 weeks. These changes take a little while to put in place, right?
Yeah, we talked about that earlier.
Right. Yeah. So we want to give folks a chance to kind of get moving on this. And sometimes we have off weeks. And so if we do 3 weeks, usually there's something there to look at. Yeah, we give a little grace. There's a little bit of grace. I like that.
Absolutely.
So so about 30-minute follow-ups, and then, seeing patients between 2 and 6 times. I've got some patients I see every 2 weeks because they like the constant contact, and they like the
they want to be held accountability. I was going to say, being held accountable. We see that a lot in physio as well, right? People will develop strategies and get really good at them, and then we kind of decrease the frequency of appointments, and they fall off a little bit on those strategies. And then we kind of go back, and it seems to be better when you're going to be seeing somebody who's going to ask you about the strategies or your diet, or what you're doing. We're
humans, right? We're human, and we're going to get away with whatever we can, right? We're no different than when we were in 3rd grade. So and sometimes people really like that. And again, that whole analogy sort of it takes a village when you're struggling in your health. We're here to support our clients, kind of in a well-rounded way,
in a very holistic way. Absolutely. Okay. Just a few tidbits of information for everyone now in terms of how someone can book an assessment with you. So
Sure.
if you're listening to this and you're already being seen by one of our physiotherapists in our long COVID program or one of our other programs, or our occupational therapist, they can refer directly to you. You can also call our general line at 416-238-6749, speak to one of our administrative assistants, and they can get you into Heather's schedule. You can also email if the phone's not for you or if it's very draining for you right now. If you're in our long COVID program, you can email covidrehab@cornerstonephysio.com. If you're in one of our other programs, you can email our general email address, info@cornerstonephysio.com.
That's right.
Any
That's
final
right.
thoughts, Heather?
Yeah, I
We...
just wanted to add that something that I do offer for potential clients, if they're feeling a little apprehensive about booking an assessment with me just blindly, if they feel that way, I am available to do kind of a consult over the phone if somebody wants to say, hey, this is what I have going on, this is what I'm hoping for, is this something that we can do together? And then I'm very honest, I'll tell them yes or no, and and also sometimes just to make sure that we're a good fit.
Absolutely.
Right?
So like a discovery type call for 5 or 10 minutes just to initiate that communication and sort of say, okay, yeah, this is a good path for me. I'm gonna book that assessment.
Right. And then sometimes we talk and somebody will tell me that there's this, and this going on. And I say, hey, this might not be the best time, but I'm here, but I'm
still here.
But I'm here, right? So if it's not the right time, that's okay. Right. Because the timing has to be right for you to feel like you have the capacity to step into a little bit more change.
That makes sense. Very well put.
Yeah.
Heather, thank you so much for taking the time to talk to me today and for educating all of us on all of the knowledge you have around diet. It was so appreciated. Thank you.
Thank you so much. Thank you very much, Melissa.